Right, hello, welcome. My name is Gabriel. I'll be your physical therapist today. How are you doing today?
I'm doing well.
All right, so since this is your initial examination, I just have to run through a few things before I start doing some further examination on why you came in today. Some of the things include your demographics, like some background, surgical history, medical history, some screening just to rule out any other concerns, as well as do some tests, okay? Is that all okay with you?
Yep.
So first off, can you please confirm your full name and date of birth for me?
Yeah, Alex Guzman, September 9th, 1998.
Okay. And your race?
Hispanic.
And what you identify as?
Male.
Male. Great, okay. And can you please talk to me about your past medical history, any experience with hypertension, diabetes, cancer?
No.
None of that? Okay. Any past surgeries?
No.
No? All right. And talk to me about like your general health. How would you describe your general health?
Fairly active.
Very
I go to the
active.
gym maybe 3 times a week or so.
3 times a week is what you, okay. And how about smoking, drinking?
No.
None of that? Do you have any difficulties with sleeping?
No.
No? How about your nutrition status?
What does that mean?
Like, do you eat 3 well-balanced meals
Yeah.
throughout the day? Okay. Let's see. Do you have any customs or beliefs that you should let me be aware of? Okay. Alright, so I'm going to go through a review of systems, which basically means I'm going to just ask you a series of questions to rule out if you need any referral to any other healthcare provider, okay?
Okay.
Okay, so do you have any problems thinking or remembering?
I don't think so.
No? Okay, great. Any problems with dizziness? No? Vision, hearing, tasting, smelling?
No.
Any of that? Swallowing?
No.
Do you have any problems with your heart, breathing,
No.
lungs? How about any digestion problems?
No.
Your sexual reproductive functions? Your arms, you picking up things, dropping things?
No.
No? Do you have any problem walking, balance?
No.
Any numbness or tingling?
No.
No? Okay. So now I'm just gonna ask why you came in today. So in your chart it says you mentioned shoulder tendonitis, is that correct?
Yeah, my shoulder's been hurting.
It's been hurting. Can you tell me about like when these symptoms started happening to you?
Yeah, it started about a month ago. I noticed when I would go to the gym, when I would do chest day, I would get pain in the front here.
Oh, right in the front.
Yeah, now it really hurts when I do things like putting away groceries.
Some overhead stuff?
Yeah, when I'm reaching, yeah.
Got it. And then how would you describe your symptoms? Is it like a sharp pain?
Sometimes it's mostly more like when I go up, it starts to be a little painful, like after a workout, it's kind of like achy.
Achy?
Yeah.
Okay. And are these like usually, do you experience these achy feelings throughout the day, or do they come and go? Usually?
It's just usually when I do certain activities. It's really like the reaching overhead.
Okay, got it. And within the last 7 days, how would you rate your pain on a 0 to 10 scale? 0 being no pain at all, 10 being like the worst imaginable pain.
Like the worst it's been, or right now?
We'll talk about now in a bit, but just like generally within the past 7 days.
It'll get up to maybe like a 5 when I reach
5. Okay, got it. And have you had any prior treatment done on the shoulder?
No.
No past physical therapy?
No.
How about any imaging done?
No, the doctor sent me here.
Doctor sent you here? Okay. And you said it mentioned you like some overhead things like putting groceries or?
Yeah, if I was like, anytime I'm at the gym, I kind of avoid doing the bench now. I'll use more like machines.
Okay.
Or like if I'm hanging up my clothes, sometimes if I go too quick, sometimes I'll notice like,
Got it. So those are really the only things that affects you in your daily life, or is there anything else?
Yeah. I haven't really noticed any difficulties like lifting or anything. So.
Okay, great. And what do you do for work, if you don't mind me asking? Does it affect your work?
No, it doesn't. I'm a dog walker.
Dog walker? Okay, so really not much overhead. Just really
they're big dogs, but they're down here, and I'm fine.
Okay, great. And what do you expect out of physical therapy?
To get my shoulder better. I wanna get back to doing the bench.
Okay, well, great. Great first step in doing that. Those are pretty much all the background information that I need from you. Our next thing is I'm going to do what's called a systems review. And I'm just going to assess some of your vitals first, being the heart rate and blood pressure, okay?
Okay.
All right, so first, I'm going to have you put this, so I've wiped this all already. just a sanitation, put this on your finger, just go ahead and relax. All right, 65. Next I'm going to take your blood pressure. Is there a preference of arm that you would like?
I don't care.
Is there any complications that I should be aware of before I take your blood pressure?
Nope.
Nope. All right. So you can just put this arm here, top of the table. You mind if I roll your sleeve up?
Nope.
Actually, do you mind holding this for me, just so I can get a better, clearer view? All right, I got a reading of 118/78. Is that usually what you get for your blood pressure?
Yeah, somewhere around there.
All right. So what I'm going to do next is have you stand up for me, please. I'm just going to be screening anything that may be concerning in your lower half. So you can stand perfectly there. So I'm going to demonstrate the movement first. What I'm going to have you do is perform a bodyweight squat. So I'm here to do it. It's going to look like this, arms right in front of you, and you're just going to bend down and reach as far as you can and come back up. All right? Whenever you're ready, go ahead. Okay, perfect. So for our next thing, I'm going to have you stand on, can you back up for me just a little bit? All right. I'm going to have you stand on one leg. So I'm going to demonstrate first. So it's going to be like this. Hold for a few seconds, and then drop it, and then bring your other leg up, okay? Just like that. Relax. Get your other one. Okay, and down. Perfect. Now I'm going to just see how well you can walk. So I'll have you go from this wall here. Your back can be against the wall just like this. And you're going to walk towards me, up to this chair right here. And you're just going to walk as you normally do. And you're going to go down and back whenever you're ready. All right. So for our next assessment, I'm going to have you do the same distance, but you're going to bring one heel right in front of the other. You're going to do that for the same distance. Go ahead. All right, perfect. You can come back to the chair here. See? Performing a rapid alternating movement test. So you're going to place your palms on your thigh and you're going to flip it to this guy and you're going to do that as fast as you can. So you can do this for 5 seconds. Ready, set, go. 2, 3, 4, 5. Perfect. Now I'm going to do a finger to nose test. So you're going to put your finger on your nose. I'm going to hold my finger out and you're going to bring that finger to this finger right here and you're going to go as controlled as possible. Go ahead. Go, a couple more times. Okay, you can switch fingers, do the same test. dive in your neurologic system, and I'm going to be doing some sensation tests. So I'm going to be tapping on the back of your head, and I'm going to work my way down your arm. And the purpose of this is to see if you have any sensation, and more specifically, if there's any differences in the side. And obviously, if there's any pain involved, just let me know, okay? So I'm going to first be putting my hands behind your head, and I want your eyes to be closed for all of this. Just let me know if you can feel it. All right? Feel that?
Yes.
That?
Yes.
Is there any differences?
No.
Right there?
Yes.
There?
Yes.
Any differences?
No.
Okay. Pull your collar down. Right there?
Yes.
And there?
Yes.
Any differences?
No.
No? I'm going to roll your sleeve up, okay? You feel that?
Yes.
And that?
Yes.
Any differences?
No.
Okay. Can you bring your palms to the ground for me, please? There you go. Feel that?
Yes.
Feel that?
Yes.
Any differences?
No.
Feel that?
Yes.
Feel that?
Yes.
Any differences?
No.
No? Flip your palms over. You feel that?
Yes.
You feel that?
Yes.
Any differences?
No.
You feel that?
Yes.
Feel that?
Yes.
Any differences?
No.
Okay. So for our next test, I'm going to touch all the same spots, but I'm going to be doing a pinprick sensation. So it's going to be a very light touch. I'll demonstrate on me, and then on you. So just that light touch, okay? Same thing, keep your eyes closed for the duration. You feel that?
Yes.
You feel that?
Yes.
Any differences?
No.
You feel that?
Yes.
You feel that?
Yes.
Any differences?
No.
You feel that?
Yes.
You feel that?
Yes.
Any differences?
No.
You feel that?
Yes.
You feel that?
Yes.
Any differences?
No.
Flip your palms over for me, please. You feel that?
Yes.
You feel that?
Yes.
Any differences?
No.
All right. You feel that?
Yes.
And that?
Yes.
Any differences?
No.
Flip your palms for me one more time. You feel that?
Yes.
You feel that?
Yes.
Any differences?
No.
And that?
Yes.
That?
Yes.
Any differences?
No.
No? Okay. Okay, so next I'm going to be testing your reflexes in 3 spots. In your left hand, your biceps, on your forearm, and then on the back of your arm, okay? We'll be testing on both sides. So go ahead and push into my hand. Okay? Side. Push into my hand. All right. Okay. Check. Forearm. Go ahead and push into my hand for me, please. Okay. You go ahead and do this for me, just so I can try and ramp up your nervous system, right? Maybe get a stronger reflex. Okay, relax. Push into my hand. The last one on the back of your arm. Push into my hand. Push into my hand. All right, relax. So next I want to establish a baseline of your current pain and stuff like that. So you can go ahead and stand up for me, please. Do you feel comfortable removing your shirt?
Sure.
Okay, you can go ahead and do that. Alright, so back up right here. Okay. Can you please point to me where specifically you're experiencing pain currently? Right in the front, okay. And how would you rate that current on a 0 to 10 scale?
Right now, maybe a 1.
It's a 1? Okay, great. So I'm going to have you perform some movements, and the purpose of this is to see the quality of the movement, if it's nice and smooth, and to see if I'm reproducing any of the symptoms that you've been experiencing, okay? All right, so I'm going to start at your head. So I'm going to have, can you face me? That way, here we go. So the first one, I want you to tuck your chin. Okay, perfect. And then look to the ground for me, please. All right, perfect. And now up to the ceiling. Right, okay, next. Now I want you to look over your right shoulder. Okay, and over your left shoulder. Any pain so far?
No.
No? Now bring your ear to your shoulder. All right, and then your other shoulder. Okay. Now you want you to bring one arm up as high as you can, keeping your palm facing you. Got it? Back down. And then your other arm. Right, and back down. Any pain so far?
No.
No? Okay, now I want you to bring one arm behind you, keeping your arm straight, and then your other arm. Okay. Your other arm. All right, perfect. Now I want you to bring one arm up as high as you can, and back down. All right, so the other arm. Any pain so far when doing that?
No.
No? All right. Next, I want you to bring your arm across your body, and then the other side. Okay. All right. And now I want you to tuck your arms in, just like this, and bring one arm in, and out, and the other arm in, and out. Bring one arm out. Okay, perfect. And then the other arm out. Just like that. Any pain so far?
No.
No? All right, now I'm going to have you bring one arm up just like this. And I want you to bend it and back out. And then the other arm, bend it and back out. Any pain?
No.
All right. Now I want you to bring your palms to the sky just like this. Flip your palms to the ground and then flip them back over. Any pain?
No.
All right. And now I want you to curl your wrist towards you, like this. All right, and back down. Any pain?
No.
All right. And now I want you to bring into the middle, just like this. Yep, and back out. Any pain?
No.
All right. So I'm not gonna do those same movements, but I'm gonna move them for you, and you're gonna tell me if there's any pain. Okay? I'm gonna have you lying down here on your back. You're gonna have to lie down so I can do your neck first. Lie down for me, please. Can you scoot a little bit more off the table? Okay. All right. Move you through the same motions. Can you scoot a little bit more off the table just so I get a full range of motion? Okay. Any pain so far?
No.
pain?
No.
All right, you can go ahead and scoop back. So your head's on the table now. And then the shoulder movements, can you scoot a little bit more towards me, please? All right, so just go ahead and relax for all of this. And here. And feel right there, give it a little more pressure. Okay, any pain with that?
No.
No? Okay. Any pain?
No.
No? Okay. So this is the scapular pull out. Okay. Any pain so far?
No.
No? Okay. Okay, I'm gonna do the same thing on the other side, so you just scoot towards the other side for me, please. Are you comfortable without a pillow?
Yeah.
Yep. Okay. All right. Any pain so far?
No.
No? Okay. Right, and then yep, okay. So I'm gonna have you sit up for me, please. You come to the corner. So here, I'm gonna just raise your arm, bend it, just like this. Okay. Any pain?
No.
Any pain?
No.
No. Any pain so far?
No.
All right. So we're done with that. Now I'm going to I'm going to do some strength assessments. Okay. I'm going to do basically all the movements I just took you through. I'm just going to see how strong you are in those movements. All right. So we're going to begin at the head. Just make sure the ankle's right. That's fine. Alright, so what I'm going to do is I'm going to be applying very little pressure to start, and I'm going to slowly ramp up my pressure about 5 seconds. All I need you to do is just resist the pressure I'm giving, okay? I'll give you. So I want you to tuck your chin and look towards the ground, just a little bit. Perfect, just right there. And don't let me push you, don't let me push your head, okay? Again, I'm going to start very soft. Ready, set, go. 1, 2, 3, 4, 5. All right, relax. Now I want you to look towards the ceiling, okay? 2, 3. 1, 2, 3, 4, 5. Okay, relax. Now I want you to look over your left shoulder. Okay. Don't let me push you away. Ready, set, go. 1, 2, 3, 4, 5. Okay. Now over your right shoulder. Okay. Don't let me push you away. Ready, set, go. 1, 2, 3, 4, 5. Relax. Bring your right shoulder to your right ear to your shoulder. Okay. Don't let me push you up. Ready, set, go. 1, 2, 3, 4, 5. Relax. And now the other shoulder. 1, 2, 3, 4, 5. Relax. Okay. So now I'm going to be working on your shoulder. Bring your arm out in front of you. This right arm. Stabilizing your shoulder. I'm going to be pushing down on your elbow. Again, I'm going to start very soft and go at 5. Okay. Ready, set, go. 1, 2, 3, 4, 5. Okay. I don't want to lower you just a little bit more. Okay. Move your shoulder up. Ready, set, go. 1, 2, 3, 4, 5. Relax. Okay. Now, bring the shoulder back. Don't let me pull your arm forward, okay? Ready, set, go. 1, 2, 3, 4, 5. Bring this shoulder back. Don't let me pull you forward. Ready, set, go. 1, 2, 3, 4, 5. Okay. Now bring this shoulder up, just like this. Which is the angle. I don't like the angle. Okay, ready. Ready, set, go. 1, 2, 3, 4, 5. Relax. Any pain in any of these movements that I'm doing?
No.
Okay. Ready, set, go. 1, 2, 3, 4, 5. Relax. Okay, now bring this arm just like this. Okay, raise it up. Weight in. Let me raise the table for you. Still more. Okay, so okay, bring this arm up. Don't let me push this arm out, okay? Ready, set, go. 1, 2, 3, 4, 5. Okay, now this arm. Ready, set, go. 1, 2, 3, 4, 5. Any pain so far? Okay. Alright, so now bring it back up again, this arm. Okay, now I want you to bend it. Don't let me pull your arm out, okay? Ready, set, go. 1, 2, 3, 4, 5. Relax. This arm. Ready, set, go. 1, 2, 3, 4, 5. Relax. Any pain?
No.
Okay. Bring this back up again. And now don't let me push you in. Ready, set, go. 1, 2, 3, 4, 5. This arm. Ready, set, go. 1, 2, 3, 4, 5. Relax. Alright, so next thing I'm gonna have you tuck your arms in just like this. And now I want you to bring your palm to the ground. Now don't let me push your palm up, okay? Ready, set, go. 1, 2, 3, 4, 5. Okay. Flip your palm over. Don't let me push your palm down, okay? Ready, set, go. 1, 2, 3, 4, 5. Okay. Same thing. Don't let me push your palm up. Ready, set, go. 1, 2, 3, 4, 5. Okay. Flip. going to do this. Okay, actually I'm gonna have you sit in this chair here. And when you sit in the chair, hug your arm up, go a little this way. Go. I don't think I passively took you through the moment. Actually, I did. Yeah. So, okay, bring your wrist slightly up. And don't let me push down, okay? Ready, set, go. 1, 2, 3, 4, 5. Okay. Don't let me push your wrist up. Ready, set, go. 1, 2, 3, 4, 5. Okay. And then check on this arm. So stand up for me, go on the other side. Sit down for me. Okay. Don't let me put your wrist down. Ready, set, go. 1, 2, 3, 4, 5. Okay. Don't let me push your wrist down. Ready, set, go. 1, 2, 3, 4, 5. Okay. Right. So that will conclude our strength assessment. Is there any pain so far that you're experiencing, any reproduction of symptoms?
No.
No? Okay. So next I'm going to do some measurements. Let me grab my goniometer. So I'm going to be measuring your left shoulder. You're gonna do that same movement. You're gonna do this same movement, just like this. And you're gonna bring it as high as you can. And I'm gonna measure how far you're able to do that, okay? Do you mind standing up for me? All right, so go ahead and bring it up for me as high as you can. Right, so line, right there. 150 degrees of shoulder flexion, active range of motion. Now I'm going to be doing a passive range of motion of your wrist. So go ahead and sit down for me, please. Okay. So, if you put this wrist on the table, I'm going to be measuring your flexion. So when you bring your wrist up just like this. So go ahead and bring out your fingers like this, and now bring it up as high as you can. Okay. So, 75 degrees. So let me take you through the movement now. And 84 degrees of passive wrist flexion. Any pain or symptom, any reproduction of. Alright, so next I'm going to palpate your shoulder. I'll have you lie down on the table for me. And on your back. What I'm assessing. So what I'm looking for here is any pain when I'm touching, or any tightness, any warm swelling, okay? Okay, so here, should be feeling around. Is there any pain right in the front here?
No.
No, how about in the back?
No.
The side?
No.
Okay. Here. I don't feel any swelling or warmthness to the touch as I'm feeling around. And neither any taut bands. Okay. Any pain so far?
No.
All right. So lastly, I'm just going to do a joint mobilization on you. So you can go ahead and sit back in this chair. Maybe and sit here for me. Okay. Okay, back from the face. Put your wrist on there. I'm gonna sanitize. I touched that. Alright. So, what I'm looking for here is, again, any reproduction of any symptoms or pain you may be experiencing, as well as how tight the wrist is, okay? So I'm putting my stabilizing arm right here. And I'm feeling for that space. And I'm moving your wrist up and down to just confirm I'm in the right area. And now I'm just going to be doing, I'm pushing down with my body to find R1. And then push a little more to find that end range right there. Okay, we'll do that again. Okay. Any pain when I'm doing this?
No.
No? Okay. Alright, so. Alright, and then one thing I forgot is to simulate if you're a 4 out of 5. So I'm gonna do that, okay? So I'm gonna do that with shoulder flexion. So, okay, so I found that you had some, I was able to kind of break your arm with some moderate resistance when I gave you pressure when you were doing this motion here. So I'm just going to do that 3 times to see if you fatigue, which would indicate some sort of neurologic lesion, or if it's the same, it'd be considered disc atrophy, okay? Okay, so bring your arm up just like this. Okay, same thing, we're gonna apply light pressure, and then slowly ramp up. Ready, set, go. 1, 2, 3, 4, 5. Okay, we'll try that again. Ready, set, go. 1, 2, 3, 4, 5. Okay, one more time. 1, 2, 3, 4, 5. Okay. All right, so that completes my finding and my assessment. Is there any other questions or concerns that you have for me before we end today?
No.
No? All right, well, you're free to go.